Jim and I have been married forever. We live together, work together, write together. Um, we are 24/7. We are together. We always were big dog lovers. We just lost our last dog about a month ago, so that's still pretty emotional. We have two sons, two daughter-in-laws, and now four grandchildren, and from ages of 4 months to 7 years. My name is Nikoo. I have lobular breast cancer. I was diagnosed with stage 1 in 2003, stage 4 in 2022, and I live in California. First son, I was 42 years old. We lived in Connecticut, and I had a perfect mammogram. And what happened was, I just went and saw my GP, general practitioner, and after the perfect mammogram, she did a breast exam on me, and she felt a hard tissue under my arm. So she insisted on I should go and check this out. And I went in, and at the time, I went to the Comprehensive Cancer Center in Connecticut. We were living in Connecticut, and they even thought this was nothing because again, I had all clear scans. And but then they decided to do a biopsy, just a needle biopsy, and that needle biopsy came back. I had a invasive cancer. I had a lobular breast cancer that had never shown up on the mammogram. So I had two lumpectomies to remove it. The tumor was so small, was only zero point 0.9 centimeters. So I had 30 sessions of radiation. I had 5 years of tamoxifen. All indications were that um, this was so small and was totally gone away. And I'm pretty sure they used the word cured on it. I know a lot more now, but at that time, that's what they thought. It was pretty emotional because I was in perfect health, perfect, no family uh, nobody in my family had breast cancer. So it was really, and again, every year I had mammogram, and at age 42 and a young family, you just, um, um, my first reaction was to just hide it from my kids because I was like, I didn't want to affect their lives. But then, I had one pre-teenager, one teenager, and we talked at the family, and thank goodness I had Jim on my side, and we had this running joke between us that anytime I would get emotional, Jim would say soccer field because soccer field was our code name to just smile and laugh because we both coached our boys in soccer when they were pee-wees, and while other kids ran around, our two boys were like leeches attached to our legs as we were walking around. So anyway, that was our code word. But we both managed as a family, we managed to get through it, and we thought I was done with it. At that time, there was only BRC1, BRC2 they checked for, and all of those were negative. And again, I went to a genetic counselor, and as they went through the whole thing, there was no reason for concern. Again, I thought I had such a clear picture of this was a fluke, and it would be something that it will not come back. And I think the statistic at that time was that 99% it will not return. And I know now that they didn't know enough about lobular breast cancer at that time. But anyway, I thought just because in my last life I was a scientist, even though that I had this very easy, simple cancer, I went through to get monitored every single year. I asked for some MRIs. I asked for ultrasound, and year after year. Well, the monitoring stopped after 5 years. That's what it was at that time. I requested to be watched for 10 years, and nothing ever showed up. I just lived my life. I had a very again healthy lifestyle. when we moved to California 8 years ago, I immediately thought that, uh, found an oncologist. Again, in the back of my mind, uh, I had this like inkling that this cancer was someplace there in my body, even though I had no symptoms. But I wanted to be under, I have a relationship with an oncologist. So again, when I came to California, I was under care oncologist. And again, she felt that no reason for concern. And I was still seeing her every year, having a mammogram, having occasional ultrasound. And again, nothing showed up. Nothing showed up until 2022. In January 2022, I had all different kind of GI issues, and I knew my body, and I knew there was something wrong with me. I went and saw my gastro doctor, and she reminded me that I had a clear colonoscopy and endoscopy the year before. There was nothing wrong with me, and she gave me took medication for IBS, irritable bowel syndrome. And again, I knew my body. There was something wrong with me. I There were many mornings I woke up, I was nauseous. Uh, I started developing food sensitivity. I went and saw my general practitioner, and she said, "Let's scan this. Let's just go one step further and have a CT, ultrasound and CT of your abdomen." They did that, and they showed an area of concern in my right kidney. Then they referred me to a urologist, and the urologist, they did a biopsy. They thought, oh, you possibly could have bladder cancer. They did a biopsy, extensive biopsy, came back at nothing, as it was just inflammation. Then the urologist wasn't concerned, and he said, let's go a second time. And this time they did a massive biopsy of my abdomen and not my abdomen, of my bladder, and again came back as that this is just inflammation and there's nothing there. Meanwhile, my symptoms are persisting, and at the time the um, oncologist that I was under care of, she said, "Okay, there's nothing else we could do. Let's see you in 6 months and see if this persists." Um, Once again, I knew my body. I knew there was something wrong with me. I went to a different doctor, to my gynecologist, and I said, for years, you've been talking about removing my ovaries. Let's do it. I was self diagnosing myself at that point because I'm like, there's something wrong with me. And she said, fine. And then she ordered a surgery. And at the time of the surgery, different hospital, different group, when they went in with the scope in my abdomen, they found that lobular breast cancer was spread everywhere. It was covering the lining of my peritoneum. It was everywhere. Basically, and then when the testing came back for that, it showed that my cancer of 20 years or 19 years earlier had returned. It was the same cancer. So that was when I realized that how important it is for patients to, if I had waited 6 months to come back, I could have been dead, considering how extensive that cancer was in my peritoneum. And that was when my advocacy for lobular breast cancer really started, because I realized there's so many patients like me, and this cancer doesn't get recognized, and it gets um, scans don't see it. Scans, it doesn't have the protein to form a solid tumor. I woke up from the surgery expecting that my ovaries were going to be gone. And I woke up from surgery and I started, like touching my stomach, thinking, okay, I'm going to have this massive like incision, so forth, all that, because, they were telling me that that's what it might involve, even though that was laparoscopic. But I'm looking for like signs. And all of a sudden I feel something in my chest and I touch it and I'm like, what is this? I had a port. And immediately that was a sign. This is before even like the nurses came back to check on me. And I'm like, why do I have a port? Why did they give me a port? That was, I think, the first shock that uh, there's something wrong. because they wouldn't give you a report unless they're preparing you for chemo. And that was when Jim walked in and the nurses walked in and they told me, well, they just saw something. No, your ovaries are still there. They didn't remove them, but there's something there. You're just waiting for results. But, to me, I knew right away. I knew right away there was something wrong because there's no reason to give a patient a report during surgery unless you expect the worst. I had the surgery on Thursday. By Sunday, I got a phone call from my oncologist, the same oncologist that told me see you in 6 months, that she said, "Nikoo, well, the good news is that you don't have ovarian cancer. The bad news is that you have your breast cancer of 19 years early has returned." And at that time, at that moment, I knew that I had to find different care. I had to be under a care of specialist for lobular breast cancer. So anyway, my path was set at that moment. And I'm a kind of person that when somebody said something like that, and did, by the way, it went over 6 months. Over 6 months, I was battling the different um, groups and insurances and doctors and trying to get their attention that there's something wrong. And I wouldn't give up. And for 6 months, I fought with them to try to pay attention to me because as a woman, I felt like I was being just looked over. And so at in a way, once I knew what I had, it was a relief. I'm like, okay, this wasn't in my head. There was something wrong with me. And that was pretty emotional, but at the same time, validated my feeling because I knew all along. I knew there was something wrong with me and they weren't paying attention to it. Initially, I knew I had to go on a treatment right away. And when I met after this diagnosis, I met with the oncologist when she started giving me the, okay, this is your line of treatment. That's what we're going to do. I said, could you please wait a second? And I pulled up my chair and Jim did the same thing. He was in the room with me. He pulled up his chair. And then I said, I have some questions. And she said, oh, you're one of those patients. And I realized that that again was on that flag that yes, every patient should be one of those patients at every level of their care. And then I went on and sought a lot of information from Lobular Breast Cancer Alliance. It's a national organization that gives you so much advocacy for lobular breast cancer. And I went on, got involved with them. I contacted them. I did a story for them about my story. In fact, they asked me to speak at the national conference because my case um, it's so often it missed by oncologists around the country. So I spoke at Pittsburgh about my case, and on the same panel, there were oncologists from MD Anderson and Cleveland Clinic, specifically speaking to my case that lobular breast cancer gets missed by all these imaging. And meanwhile, I was researching who are the experts in the country that are specialists to lobular breast cancer. Then I realized there was an oncologist right in San Diego that she's absolutely a amazing, amazing researcher, and she went her own clinical trials and so forth. And she wasn't accepting mutations. So I basically used every influence I have. I reached out to my GP and I'm like, I appreciate all the good words you could put in for me, but I need to see her and I need to speak to her. And she made sure arranged an appointment for me. And then I went and saw her. And the moment I saw her, Jim and I got there, she asked us, why don't you pull up your chair so we could talk about what the game plan is? And just those words make such a difference in me. And I'm like, I had a seat at the table. And I'm sorry, I'm getting emotional. So that started, and she took me as a patient, and I've been with her now 2.5 years, and I'm very involved. That she got me involved in a number of advocacy, a number of clinical trials that she's working on. In fact, speak at the conferences with her. And it's been I've been a different person since I had the right care. And I work with somebody that hears me, understands me. I started with Kisqali and anastrozole. That's a CDK4 inhibitor, and that's like a gold standard right now. And all patients that are metastatic pretty much start with one of the classification of CDK4. And one of the things I fought for when I first got diagnosed, because I was already reading ahead of what my first oncologist knew about. I was bringing her information, asking her, "What do you think of liquid biopsy? What do you think of FES, PET scan?" And all those things she actually knew nothing about because they were so new. And when I walked into my new oncologist, first thing she did was she put a box of for the liquid biopsy in front of me, and she's like, "From here, you walk into the infusion lab, and you're gonna have this blood test done because we need to know what all your do a complete study of what all your mutations are." Which was this is exactly what I was fighting for. I need to know that. So after CDK4 failed, which for me was clockwork, at 2 years, I started having all the symptoms in my GI again. But my oncologist was like ahead of that. She didn't wait until I went back to where I was like 2 years earlier. As soon as I had the early symptoms, she you know, she gave me actually a MRI of the abdomen, which that is the only scan that shows even not 100%, but at least has the best imaging of what lobular breast cancer does in the body. And at that time showed that some of the lymph nodes were enlarging again. So at that time, I already knew that from the liquid biopsy, I knew that I had a PK3 mutation. So I went on the new drug that was approved. That was TrueCap. Now, TrueCap all kind of really bad side effects, but I somehow managed to go through them for 6 months. And then as soon as that started failing, my oncologist put me into this, and we discussed it. We uh, found out, again, it was a joint conversation that that was the best line of care for me. I got into a clinical trial, and I've been on that now 6 months. It's a phase one, and so far the side effects are manageable. There are some areas of concern, but she's already lined up, and that's one of the things I love about her. She already had lined up. Okay, these are your three options, four options, five options that you would move from this drug. So we could talk about it, and also this clinical that is, again, it's a phase one. So, a phase one clinical trial requires a lot of commitment by the patient as well, because you're there sometimes 3 days a week, 12-hour days. But I'm willing. My feeling is anything at this point I could do that will improve the life of lobular breast cancer patients, which is such a you know sneaky disease. I'm willing to do so. So I already know once this fails. I'm actually already leaning toward down the clinical trial. So that's where we go. I think every metastatic patient hopes that there is a cure. Of course, that's something that always is said. My biggest hope is just, especially especially for lobular breast cancer, I really hope it more of a understanding of what this disease is, because there's only 15% of the patients that have it. And right now, there are very few clinical trials that specifically address that. So I'm getting narrowed in this field because I feel like my hope is that more oncologists around the country will recognize what this disease is and um, diagnose patients sooner. Uh, just since I got involved with Abigail, I've had mentees that passed away from this disease because it got diagnosed too late. So we are doing a big drive trying to um, pass the word. I mean, my oncologist is one of the ones that goes around the country, goes around the world, teaches other oncologists to recognize, to identify, to diagnose this disease, lobular. So my hope is that that gets, you know, identified. Trust your body. Trust your body. There is no way I would be sitting here 3 years post diagnosis if I hadn't trusted my body. I knew there was something wrong with me. I had symptoms that were being disregarded. But to me, is every person, especially women, I believe they have to trust their body and know that this is a new symptom, and that's not my body doesn't behave this way. So I think that's what they should take away and act on it. Act on it.